Center one now.
There we are.
Oh.
It says live.
Oh, okay. We're having some connectivity issues, so whether or not this is working, I guess we'll see, but we're going to go for it. Dr. Stephanie here, Dakota Natural Health Center, and this is Alicia.
Hi.
And if you've been here, especially in the pharmacy side, you've probably seen Alicia because she does a lot of our marketing and whatnot, but she's also finishing some schooling as a certified health and wellness coach.
Yes.
And she got into this certified health and wellness coaching because of her own journey with thyroid issues.
Yes.
So a lot of you have seen from our page that we've got a clinic date coming up where we're setting aside time to test thyroid labs for people, and it's a very comprehensive list of tests, probably more so than what you'll see pretty much anywhere else, including most endocrinology offices. The reason that we wanted to focus on thyroid is that it's a huge percentage of the population is affected. Something like 60%, excuse me, I'm going to have to look at the data again, but it's a huge percentage of people walking around with a thyroid issue, and up to 60% of them don't know that they're having thyroid issues. We also have an issue within the conventional medical system of thyroid being undermanaged quite frequently, so we're looking to sort of change that and empower people to have a better understanding of their thyroid and what it does and why supporting it is so important and how to do that and what these different lab values mean. So over the course of this week, we are going to do a couple of live posts or live videos and try to just give you little bits of information along the way. So we're not doing any big videos. We're going to try to do a couple of shorter videos. So Alicia was gracious enough to help me because she's done a lot of extensive reading and training, more than the average bear for on thyroid issues. So she's going to be really helpful, I think, in both with the videos, with the testing, and then moving forward as a certified health coach, she'll be able to help us better manage our patients with thyroid issues. So basics for today, and we're going to build on it, and then we're going to end the week with a Q&A session. So as you guys post questions, we'll answer them as we can, but if we can't answer them on the fly, we will save them for Friday and try to just knock out a number of questions at that point. So starting at the beginning, your thyroid gland is what we call a little butterfly-shaped gland that sits around the base of your neck. So somewhere right in here is generally where the thyroid gland is actually located. It is a key endocrine gland, so it's, what's the word I'm looking for?
Plays a very important role.
Right, okay. In managing other parts of the endocrine system. So somebody who has thyroid imbalance or low thyroid function or even a high thyroid function can end up having troubles throughout other systems. Main systems affected. Now we can see hormone levels change, sex hormone levels change because of thyroid issues, adrenal hormone levels change because of thyroid issues, we can see digestive changes, we can see skin changes, we can see mood changes. Depression is it can be a first symptom or deeper symptom of low functioning thyroid. That might be a good spot to mention, when we talk about the thyroid, we can talk about hypothyroidism, which is under-functioning, and versus hyper. So hyperthyroidism, which is an over-functioning thyroid, less common. Hypothyroidism is a lot more common. So so symptoms, Alicia's going to mention a couple symptoms focusing on hypothyroid symptoms, being that that's much more common and what we tend to catch more often, and we'll end with a couple of typical hyperthyroid symptoms as well. So take it away.
Okay.
Alicia.
The most common is fatigue, weight gain, lethargy, feeling cold, sensitive to the cold, always being cold. You always need the heater on. You always need an extra blanket or a scarf. Brittle hair and nails, your hair falling out. And you can have a combination of all of these, or you can have one that's way more dominant than the other. And as you learn your thyroid, you'll learn which things are affected more for yourself, and you can start to feel those things. But those are just kind of the common ones.
I would also mention, I would add constipation. and I guess depression I had already mentioned. Yeah, or just mood changes. A lot of people too, just as a little bit of a side note, will say, well, yeah, I have these symptoms, but my doctor checked my thyroid and it was fine. There's a difference between fine and optimal. And some people are definitely sensitive enough to where along that scale that they are, to make it, while it may look like splitting hairs on paper, we can see a huge change in symptoms when we get those numbers out of the fine range and into the optimal range. So just to kind of throw a couple of hyperthyroid symptoms, these are when the thyroid is overamped, and that's essentially how the person feels. Viral infections and some other things can cause these. Autoimmunity can cause hyperthyroid in some cases. That could be rapid heart rate, sweating, weight loss, nervousness, anxiety, irregular heartbeats. So, if that's something that you find yourself experiencing, especially after a significant stressor or an upper respiratory infection, definitely good to be evaluated. So, this is Fast and Furious. Thyroid 101.
Yes.
To be continued tomorrow. If you have questions, make sure you're posting them so that we can add them to our Q&A on Friday. And we're going to aim for noon hours as best as we can.
Yes.
We'll just see how it goes. So, okay.
Thanks for tuning in.
See you next time.